So hi everybody. How you doing? How was your summer? I hope everybody had a wonderful summer and enjoying the beautiful fall season. It's time to study, time to sleep, time to eat, and let it go. Unnecessary things, negative thoughts, and negative ideas, negative people, all the garbage needs to go away. So today's presenter is Lisa from Canada, and I am so excited to introduce Lisa to our Shiatsu community. She's been teaching and she's treating people for so many years. And she teaches and she practices Shiatsu. She treats patients at the hospital in Canada. It's such a wonderful things, and we cannot wait to hear her journey. It's so inspiring. Thank you, Lisa, for joining today.
Thank you, Kumiko. I'm happy to be here.
Thank you. And let's put the both hands together and let's start meditate down. Can you share the mantra with us? Now let's breathe in and out. Put hands and mind together and meditate. Then breathe in and out. Let's feel strength in your hara, in your tandem. Namu Shinyo Ichinyo Toto Toki Miho Tokeo Nenji Tate Matsuru Zangi Zangero Gonzai Sho Metsujo Bono Metsujo Gonsho Om Saraba Tatagyata Hanamanano Kyaromi. And let's just reflect ourselves. How's our yin-yang energy going? And let's learn from Lisa to balance our energy. Thank you, Lisa. Please take it from here.
Right. Just let me share my screen now.
Thank you.
Oh, I cannot do it yet.
Oh, no, it's okay. Can you close the screen? Yeah, thanks.
Thank you. All right. There we go. All right. Hello, everyone.
Great.
I'm very happy to be here and to see so many people from around the world join us. This is really exciting. And I think this is one of the most wonderful things that has come out of the pandemic is this gathering of the Shiatsu community around the world in different formats like this. And it makes me so happy. And I think this is going to really help us to move the profession forward over the coming years. And there's such strength in bringing our community together. And I think it will propel Shiatsu forward. So today I'd like to speak to you about my experiences working in a hospital and I'd like to share with you what that's been like for me and how our team makes that work, and also touch on some strategies that you can use, whether you're in private practice or in a multidisciplinary clinic or in a hospital-based clinic, strategies that you can use to enhance collaboration with other healthcare practitioners and build relationships with them. So, and I'm happy to take questions also. So if you have any, I think there's probably a chat option that you can type them into. I saw someone type into a chat earlier, so just type them in there, and we'll also pause perhaps halfway through and see if you have any questions, and at the end as well, get some discussion going. So I know some of you I've met before, but some of you I've not yet met, and so I'm glad to be sharing this with you today. So a little bit about me. I live in Toronto, Canada, and I was born and raised here and practice here. And I practice Namikoshi Shiatsu. I studied at the Shiatsu Academy of Tokyo, which is here in Toronto, and studied with Kensen Saito, who brought Namikoshi Shiatsu to Canada. And he studied directly with Namikoshi. And it was a very intense 2-year full-time program, 2,200 hours plus more than 200 hours of practicum on top of that. And a great program. And I've been practicing for 20 years now. And for the past 11 years, I've been part of an integrative hospital clinic, which has been a really wonderful experience. And before that, I was working in different multidisciplinary clinics, which was a good experience as well, but didn't ever feel like it was exactly what I was supposed to be doing, I suppose. And now where I am now, it feels like the right fit for me. So I'm thrilled to be there. I lecture internationally, and that is certainly how I've met some of you. And hopefully I'll meet the rest of you at other conferences and events in person one day. I'm a researcher as well, so I've done several research studies on Shiatsu, and currently working on a couple of others. And I have a Master of Science in Complementary Medicine Research. And I have a number of professional interests. Neurological conditions, a big interest of mine, not only Alzheimer's and other dementias, but migraine and other neurological conditions, mental health issues. I work with a lot of patients experiencing severe anxiety and depression and PTSD. And chronic pain is another of my focuses, and self-management. I'm really passionate about self-care. So I often teach patients and do workshops for the general public, teaching them how to better manage their health with self-shiatsu and with other techniques as well. And a lot of my research has focused on self-management interventions as well. So the clinic that I'm working at is called the Al and Malka Green Artists Health Center. So it is part of Toronto Western Hospital, which is part of the larger University Health Network. So UHN, we refer to it for short, is made up of 3 different hospitals and 1 rehab institute. So it's a very large organization. It's the largest healthcare, health sciences center in Canada. And it's a wonderful organization. I'm very fortunate to be part of it. So our clinic, the Artists Health Center, was founded in 2002. So next year we'll make our 20th anniversary, which is huge. And we're really unique in a lot of different ways. So we're an integrative clinic. And I know people have different ideas about what that means. And the true definition of it means that there is both biomedical care and complementary health care. So sorry, I think my screen, there we go. My screen was doing something funny. So we have both biomedical practitioners and we have complementary practitioners as well. And we work in a very collaborative manner. We're very fortunate that it's not a hierarchical clinic. So we don't have a doctor who has other practitioners underneath them that he sends patients to, but our team are all equals. And there's a lot of respect for each other and a lot of collaboration. We're also unique in that we're the only clinic, I think, probably in the world that specializes in treating the entire arts community. So there are clinics specifically for dancers and specifically for musicians, but we treat the whole range of performing and creative artists. So we see dancers and musicians, but we also see actors and playwrights and poets and sculptors and painters and stand-up comics and costume designers and sets builders and absolutely anyone who works in the arts or who's studying at a post-secondary institution, so an arts-based program in university. And all of our practitioners have special expertise in addressing artists' health needs. So I've been working with artists throughout my career, even before I joined the Artists Health Center. And a lot of our practitioners have backgrounds in the arts as well, including myself. My first career was in theater. And I was a costume builder for about 12 years and a props maker and set decorator before I studied Shiatsu. So it's quite interesting. I'm still working with my hands, and I think working as a costumer for so many years with very fine, delicate fabrics, I think really helped me to develop a really keen sensitivity in my hands, which serves me well as a Shiatsu therapist. And that career in the arts, of course, helped me to understand how working in the arts impacts people's health and well-being. They're often patients who are working from contract to contract. So they don't have a steady job, but they're working on one show and then moving on to the next show. And their income can be somewhat unstable. And I know in Canada, the average income for an artist, this figure's from a few years ago, probably about 7 years ago, but the average income at that time for an artist was under $20,000 a year, Canadian. So that's even less in US dollars for those of you there. So there are people who are living on fixed incomes some of the time and may not have funds to spend on their health. So we also have a very diverse team of practitioners, which is something else that makes our clinic very unique. We have, I think we have 15 or possibly 16 practitioners at the moment. So we have, I'm going to try to remember them all, it's difficult. So I practice Shiatsu, we have a massage therapist, we have a physiotherapist, we have 2 chiropractors who also practice cranial sacral therapy and acupuncture. We have a doctor who does psychotherapy and cognitive behavioral therapy. We have a nurse practitioner. We have a registered dietitian. We have, did I say physiotherapist? We have a physiotherapist. We have a naturopathic doctor. We have a social worker who also does talk therapy. We have a psychotherapist and we have a psychiatrist. And we have a speech language pathologist who is just joining us now. So it's a big team, and we have a lot of options for people to address not only their physical health issues, but their mental health as well. And it's really extremely rare to see that much diversity in one clinic, especially, excuse me, especially in a hospital-based clinic. It's not very common at all. So, I'm going to go back.
That sounds wonderful. You probably so many artists and such a big team that's the poetry there going on.
It is, and it's it's very unusual to have that big a team, but it's also extremely unusual to have as much collaboration and interaction as we do. So we often collaborate on patients' care plans, and there are great benefits to that, not only for the patient, but for the practitioners as well.
Oh, yes. And how many patients are there?
Oh, I have no idea. It's our patient roster is enormous. I have no idea how many we have.
Hundreds?
Hundreds,
So
certainly.
it's a big building and a lot of.
It is a big clinic. I thought that I had a slide about, I think I do have a slide coming up. I'll talk more about the space itself, which is also quite unique. Mm-hmm.
Thank you.
Not at all. So, integrative healthcare, I think, is really dovetails beautifully with Shiatsu because it's a healing-oriented approach that considers the whole being. So it takes a holistic view, just as Shiatsu does. And we consider the whole biopsychosocial aspect of a person's health. So not only their physical health, but their mental health, their emotional and their spiritual health, and their social network as well. And that's why Shiatsu is such a good fit for an integrative setting like ours. And integrative healthcare uses all appropriate treatments, so both biomedical and complementary, and that's why we get the wonderful collaborative atmosphere at our clinic, where we, our patients can access whatever treatments are best for them. And that collaboration ensures that our treatments complement each other as well and support each other. So we can see if one person has been focusing on one area of a person's health, on one aspect of it, we can adapt our treatments to complement that and support it. And it really does provide our patients with the best possible health outcomes. So our clinic, we're in a brand new space. I don't have terribly good photos of it because we moved during the pandemic. So we were in the hospital itself, which in this photo, you can see it through the windows. That tall building is part of the hospital. We were within the hospital itself in a very clinical feeling setting. So the space was adequate, but it really felt like we were in a hospital. And now we have moved to a new building that was, our space was built specifically for us. And we're part of the family and community medicine program at Toronto Western Hospital. So they have moved to this new space as well. It's a LEED certified building, so it's environmentally friendly. We have a green roof and, better lighting and so on. It's a very central location, which is great because we're sort of in the center of the arts communities, and there are a lot of different galleries and art schools that are nearby. It's a big space, so we have one exam room that our nurse practitioner uses. We have 4 different treatment rooms that our physiotherapist and our massage therapist and our chiropractors and myself use. We've got 3 counseling rooms that are beautiful with huge windows. We have a soundproof studio that our speech language pathologist can use. And it also allows us to witness musicians playing their instruments in a way that doesn't disturb people getting treatments in the rest of the clinic. So they can bring their instruments with them so we can watch their posture while they're playing and their movement, and give them advice and counseling on how to improve that to decrease pain and strain on their body. We also have a dance studio that has a sprung floor so we can watch people doing their movement, whether it's dance or acrobatics or whatever else it might be. And we have cameras in that room so that we can film people while they're dancing or while they're playing their instruments, so they can watch themselves play as well while we talk them through how they can improve that. And we have a number of meeting and workshop spaces as well. My dog is trying to say hi to everyone. She's climbing up and waving at people. So we can teach workshops once COVID allows. We can teach workshops in our space as well for small and for large groups. And we do have a number of group programs that we usually offer. So we have a narrative competence program that a psychiatrist does. We have a number of other group psychotherapy groups and some movement-based groups as well. And we do teach workshops in the community as well at the various art schools. I just did one the other day. For the first time in over a year and a half, I did an in-person workshop on Thursday, which was very exciting. So just 1 second. I'm just taking my dog's collar off her because I realize she's jingling it and making a lot of noise. So we have a lot of unique programs as well at our clinic, which is, again, something that makes us very unique and very special. So we have a subsidy program, and thanks to donations from some very, very generous donors, we have a subsidy program that people with that are below a certain income level can access, and they have to fill out an application to be awarded the subsidy, and it will allow them, I think, $750 per year for 1 year to be used on programs that are not covered by our provincial health benefits. So some of our services are covered by, here in Canada, we have healthcare that is covered by the government. And so some of our programs, like our nurse practitioner and our doctor and our psychiatrist, and our social worker, those things are all covered by our government-based health program. Other things like Shiatsu and chiropractic and physiotherapy and massage therapy, people have to pay out of pocket for that. So our subsidy program ensures that they can afford those treatments if they need them. So instead of paying the full price, they only pay 25% of the cost of those each time they come. And it ensures that every artist can get the care they need to continue creating their art. So we also, a few years ago, started an integrative assessment program. And this was something that was very exciting and, again, extremely unique. We developed this together, our practitioners, and it is an assessment that involves 3 of our practitioners. So our physiotherapist was involved, our chiropractor, who, as I said, also does craniosacral and acupuncture, and either myself or our massage therapist. And our patient would fill out a very comprehensive health history, more comprehensive than our normal one, which is still fairly comprehensive. And the 3 of us would do an assessment together with the person. So all of us in the room at the same time. And that assessment would involve looking at their posture, doing some range of motion tests, doing other mobility tests, palpation. From my perspective, that was mainly what I was doing, as well as looking at their posture and how they carry themselves and their movement. And we would then, the team would go away and discuss their case and their needs and come up with an integrative care plan for them. So then we would go back to the patient and talk about what we felt would really address all of their health and well-being needs in a comprehensive manner. And that might involve other practitioners at the clinic as well, not only the ones involved in the assessment. And then that person would be able to access those services. And we'd also give them some self-care to start at home to get them going until they were able to start seeing us. So it was a fabulous program. And as I said, quite unique. There are assessment programs that are sort of similar in some hospitals, but they usually involve the same type of practitioners as opposed to having different perspectives like this. And the patients we did this with absolutely loved it. They, I think, really liked having the expertise of different people coming together to address their needs and hearing different perspectives. And we found that patients responded very well to this as well. So we saw them improve incredibly quickly. We saw much greater health outcomes than I think we would have if any one individual practitioner had been working with them. And from the practitioner perspective, it was very, very satisfying. So for part of my master's program, for one of my courses, I did a small study on practitioner satisfaction on this integrative assessment program and what our practitioners thought about the challenges of it and the benefits of it and ways we could improve it. And we found that all of our practitioners really derived a lot of satisfaction from it. They enjoyed the collaboration with everyone else, and they really felt that it enhanced the integrative nature of our clinic and it enhanced collaboration. It gave us a better understanding of each other's disciplines and scopes of practice and what each of us could do. And it was really satisfying seeing how quickly people improved and the gains they got from this program. So it was really quite exciting. And the patients we saw for this were ones with very complex health histories or multiple overlapping conditions or people who had had long-term chronic issues that had not been resolved with other care that they had sought out. So it was, we weren't accepting just any of our patients into this program. They had to have very specific needs that we thought would benefit from it. So we're hoping to start that program again soon. The other tricky thing about this is that it was quite costly. Having 3 practitioners do an assessment with a detailed assessment with a patient is expensive in and of itself. So we had a separate subsidy program that covered a great portion of the assessment for patients so they could afford to access this. And I already mentioned some of our group programs. So our narrative competence and some of our talk therapy groups. We have had movement-based groups as well. We did have an ear acupuncture program that was a drop-in session for people that was aimed at helping with stress and anxiety. And that was quite successful as well. And I'm sure that will start up again as COVID allows us to have more people in a room. And our workshops have focused on a lot of different areas. So I do a lot of workshops for patients about managing stress. That was the one I did the other day at a dance school, was on living well with stress. And there are other ones we do for musicians and for dancers on health maintenance and injury prevention and that sort of thing. We do workshops on mental health as well and on nutrition. So it's quite a few of different practitioners who go out and teach workshops in the community. So I feel like I've been talking for quite a lot now already. So before we move on, let's do just a little tiny break and do a minute of self-care before we continue. So I find when I'm looking at a screen for any great length of time, it can be quite tiring, especially if it's a video call. It can have it can be fatiguing for our eyes. And for those of us who experience migraines, it can be, we can be more sensitive to visual stimuli. So I think it is even more of a concern to take care of ourselves when we're doing this. So we're just going to do a quick little Namikoshi Shiatsu technique that I love. I'm assuming you are all seated. if you are in a chair, make sure you place your feet on the floor and feel the floor underneath your feet. You can close your eyes and just begin with your hands resting comfortably on your legs. And with your eyes closed, just inhale through the nose for 2 to 3 seconds. Hold for a couple of seconds and then exhale slowly through the mouth for 6 to 8 seconds. So inhale for 2 to 3 seconds through the nose and exhale through the mouth for twice as long. Continue breathing like that. And now, while you are doing this, I'd like you to take the heels of your palms and place them over each of your eyes. And while you're continuing to breathe slowly like that, deeply, just apply gentle but firm pressure directly to your eyes. And now very, very slowly ease the pressure off. And very slowly remove your hands and open your eyes. Lovely. It's a wonderful little technique that's great for relieving eye fatigue, but it's also wonderful for easing stress and anxiety. So it's something that I often teach patients who are dealing with those issues. And that causes a reflex action in the body. So it lowers our blood pressure just slightly and only temporarily. But it's a wonderful way to just ground yourself if you are feeling stressed or at all anxious. I hope none of you are today. So before I continue, I'm just going to take a quick look at the chat and just make sure there are no questions, okay? Are there any questions before we move on? If you have a question, you can unmute now and ask it. Olinda has her hand raised, or maybe she's just waving. It's nice to see you, Linda, joining us all the way from Australia.
Thank you.
Oh, now my dog is barking because she heard someone speak. It's okay, Rosa. My poor dog doesn't hear very well. So when she hears a voice, sometimes she's not sure where it's coming from and thinks someone's intruding. She needs to protect me. So I'd like to talk just briefly about the benefits of integrative healthcare. I think they are many, and I think there are benefits for the patient and for practitioners, and even for the healthcare system. So for the patient, it makes things very convenient because they can access all of the services they might need in one space, which is wonderful. So sometimes our patients will come and see more than one practitioner at a time. And it's like one-stop shopping. And as I spoke of before, we often see much greater health outcomes when it is an integrative approach to treatment compared to just seeing one practitioner. Although, to be honest, I find Shiatsu extremely effective for pretty much everyone that I've ever worked with. So, but still, I find an integrative approach can be give us much greater health outcomes. Integrative healthcare really allows the patient to understand that they have different options for care. So they get, at our clinic, they get an understanding of what each practitioner can do and what our scope of practice is, what our specialties are. And so moving forward, if they have different issues, they might have a good idea of what they can access to address their issues. And it also gives the patient not only greater choice, but it increases their own voice in their healthcare plan. And I think that is really valuable. So an integrative healthcare perspective really puts the patient at the center. And then all of the practitioners are like spokes on the wheel. So the patient, when they're informed about all of their options, and they are the one that is really driving their healthcare. And that's extremely valuable. It really recognizes that each patient is a unique individual and should be involved in their care plan rather than having a healthcare practitioner tell them what they should be doing. They're a part of the dialogue to create that care plan. Now, for practitioners, it really builds a team atmosphere. So I talked about how our team collaborates, and I'll get into some of the ways we do that soon, but it really does enhance a team atmosphere. And I don't feel like I'm a practitioner working in a clinic. I feel like I'm a practitioner working with a team. And that's really wonderful, being able to turn to our colleagues for support when we need it, and to consult with when we need greater understanding around something. And it's really a wonderful atmosphere to work in and hugely satisfying. It really does foster respect for other disciplines and a great understanding for what each other can do. And again, that's really a wonderful thing to experience. It really gives us good understanding of roles and different perspectives. And again, that enhances not only our own work, how we each work with patients, but how we understand how patients are accessing care and how they're benefiting from it. So there are a lot of different things we do to foster collaboration. And
question in the chat, excuse me, Gail is asking about, she says that it's a wonderful program, and is there anything similar in the United States? Are you aware of
it? Well, when I wrote my paper on our integrative assessment program, I tried to find similar programs. And the only ones I could find were ones that had medical practitioners only. So they might have a doctor and they might have a respiratory therapist or an occupational therapist or sometimes a physiotherapist. I didn't find any that had a range of biomedical and complementary practitioners working together in the same clinic. And I know from experience in my city in Toronto here, there are clinics that claim to be integrative, but they're really more like a multidisciplinary clinic. So they may have a range of complementary practitioners. They may have a shiatsu therapist and a massage therapist and an acupuncturist, and which is wonderful, but it's not exactly an integrative model because they're missing that biomedical piece, right? They don't have medical practitioners interacting with them as well. So it's extremely rare. And I don't know if there's anything quite like it in the United States. I couldn't find anything as diverse as us. And honestly, I don't know if there is anything in the world that has quite as diverse a number of disciplines as our clinic. I think we're going to see more and more clinics of this sort developing over the coming years, because there is a real push toward integrative healthcare, right? That is really seen as the forefront of healthcare now, because we are seeing the benefits to the patient, and we're seeing how they're getting the full support they need that way. So I think slowly we're going to see more and more of these developing. Even if you can't work in an integrative clinic, though, there are ways of creating connections with other practitioners so that you can still collaborate and share knowledge and communicate on, and collaborate on patient care. And we'll get to that shortly too. So there are
Thank you, Leisa.
Not at all. And if there are any further questions, please keep them coming in. So there are a number of different mechanisms that our team uses to foster collaboration and to facilitate communication. So we really strive for an atmosphere of respect and openness. And I guess all of our practitioners working there have a lot of respect for each other and are willing to be open to other perspectives and other disciplines. And anyone who is brought onto our team, well, we only bring people on who have that same attitude. So we've really ensured that there is a lot of respect and there is an open dialogue and an open perspective to different ideas and different perspectives and learning from each other. We have regular staff meetings. So most of our practitioners are not there full time. So we have our nurse practitioner and our admin person are there 5 days a week, and the rest of us, our schedule sort of varies. So I'm there 3 days a week. There are others who are there 2 or 3 days a week. And that means that we're not all seeing each other, especially during the pandemic, when some of our practitioners who do talk therapy or who do counseling or nutritional counseling, naturopathic as well, a lot of them have been working virtually. So we're seeing less of each other than we had even. So we bring the whole team together for staff meetings regularly, which can happen virtually or in a combination of in-person and virtually. And that gives us an opportunity not only to talk about what's going on in the clinic and any new initiatives, but it also gives us a chance to share information about our own practice and about our own discipline. So I've, for example, done short presentations on Shiatsu to make sure that everyone understands what it is I do, a little bit of the theory of it, the kind of patients I work with, and then I teach them some self-Shiatsu so they get a feel of that. And we've had presentations from other staff members as well. So again, it just fosters that understanding of each other's disciplines and what we can do. We have informal case consultations regularly. So I often work in partnership with our physiotherapist with a number of our patients. So we will often have informal case consultations on how their care is going and what we need to focus on, whether we need to adjust anything and so on. We do have case reviews occasionally in our staff meetings. So we'll choose a patient who has a particularly interesting case, and we'll discuss in our staff meeting what our personal approach would be to care for that, and see what we come up with, what different ideas come up with. And again, it just allows for a greater understanding of what each other can do. And it's a wonderful, wonderful way to learn. And that really allows us to refer patients to other practitioners who they could benefit from seeing as well, right? If we know exactly what they can do to help different issues or different types of patients, then it really enhances that referral network. Right, as I said, we had overviews of different disciplines and new initiatives that different practitioners are doing, new things we've learned if we've taken new courses. We have a number of communication mechanisms. So we have electronic patient records throughout the whole hospital system, which is wonderful. So we have our treatment notes are all electronic. We can see the patient's entire health history, including other care they've had at the hospital and any diagnostics, tests that they've had, or blood work and that sort of thing, assessments from different clinics. And it allows us to also see the treatment notes from other practitioners within our clinic, so we can review their notes, see what they've addressed, see what they've found, and again, make sure that our treatments dovetail and complement each other. And we have a messaging system within our electronic patient records, so we can instantly communicate with other practitioners, give them a heads up if there's something they need to watch out for with a particular patient, or if there's whatever, something we need to communicate with them. Right, electronic health records. I'm just going to check the chat again because there's a comment. No, just a nice seeing you. Hi, I love that we met in Vienna. Hi, Rita. I remember you well. So as I said, there's a lot of different strategies we can use to facilitate collaboration and to build networks and with other practitioners, whether we're working in a home-based clinic or in a private clinic or in a multidisciplinary clinic. The most important thing we can do, and this is extremely important for a number of reasons, is to encourage our patients to inform their other healthcare providers about all of the treatments they're accessing. So if they're getting Shiatsu from you on a regular basis or irregular basis, they really should be telling their doctor or their primary healthcare provider and any other healthcare providers that they're getting Shiatsu, whether it's for a specific condition or just for general health and well-being or maintenance, and tell their practitioners, their other practitioners, about the benefits they're getting from it. That's really, really important. So one of the reasons it's so important is that their doctor or primary healthcare provider really needs to have a full picture of their patient's healthcare. And if patients aren't telling their doctors, then they don't have that full picture, and they may think that if they're seeing improvements in their patient, that they may assume it's due to their, I don't know, a medication they're prescribing or something like that. And perhaps it is in part, but it's probably also partly due to the work they're doing with us. So it's important for them to have a full picture of their care plan. Also, so that they can make sure that their treatments complement ours and that nothing is contraindicating. So for example, if we have a patient who is getting treatment for cancer, there may be modifications we need to do to our treatments, and it would be really valuable for their other healthcare providers to know they're getting Shiatsu and we're modifying our treatment so that it suits their particular healthcare needs. And this can also open up the door for communication with other healthcare providers. So with your patient's consent, you can communicate with other healthcare providers they're seeing. So you can, the easiest way to do this is to prepare information for your patient to share with them. So you could do a short summary of, the treatments you've been doing with them and the progress you've seen, maybe changes you've seen in their pain since they started seeing you, or in their range of motion if they're dealing with some sort of mobility issue, or a repetitive strain injury or frozen shoulder or something like that. Or if they're seeking treatment for migraine with you and they're tracking them and they're getting less and less of them and they're less severe. It would be great for their other healthcare providers to have that information, right? That they're getting less pain and less whatever because of the treatments, in part because of the treatments they're getting with you. So you can prepare information for them to share. And this is really great for people who have memory issues as well. So some patients, if they're dealing with persistent pain, that can affect your memory. And so they might not remember to share all of this information with their doctor or other healthcare providers. So if you prepare some information, hand it to them so they have it, they won't forget about all the little details that you wanted them to communicate to them. And of course, with this information, make sure you include your contact details so that if the person wants to get in touch with you, they have a method to do so. So give them your email, give them your work phone number. And make sure that they have a way of reaching you. And yeah, so the only key point is to make sure that you have your patient's permission if you're going to contact a healthcare provider directly. Okay, so if you do want to develop a dialogue with another healthcare provider that your patient's seeing, make sure that you ask for their permission to discuss that with them. That is key. And most clinics will expect you to have written consent to do so. And I would certainly do that even with my private patients. So, other ways that we can facilitate collaboration. If you have a particular specialization or an area of interest, then it's really easy to identify other healthcare providers who have similar interests or specializations, right? So, for example, I'm fascinated by neurological conditions, and migraine is something in particular that I deal a lot with and teach a lot about as well. And so identifying neurologists who specialize in migraine is a really great way to reach out to another healthcare provider, provide them with some basic information about what I do and how I work with patients who are experiencing migraine, how I can help them. And there are other practitioners you can identify as well, like whether they are complementary practitioners, maybe an acupuncturist or massage therapist or craniosacral therapist or something. Excuse me, I'm losing my voice. All right. Sorry about that. So yes, whether it's a complementary practitioner or a biomedical practitioner, you can identify people who have similar specializations. And this is a really, really great way to not only start a dialogue with another practitioner where you might be able to share information about the condition and about approaches, but it's a great way to encourage referrals. So it's wonderful to have other practitioners to refer to if your patient is looking for another type of care to complement what you're doing with them. And obviously, it's a great thing to have other practitioners referring to you. So in this case, I would provide some information, general information about Shiatsu. You know, keep it simple, keep it in plain language that they can understand. And if you're targeting biomedical practitioners, doctors, or physiotherapists or nurse practitioners or whatever, make sure that you explain it in words they can understand. So I find sometimes explaining Namikoshi Shiatsu is easier to explain from a biomedical perspective because it takes a more Western approach. But explaining what Shiatsu is, how you apply the technique. Sorry about the dog noise. She's getting squirrely. Explaining what it is, how you apply the technique, and a bit about the theory in more Western terms can be easier for biomedical practitioners to understand. So explaining that the pressure can release muscular tension and can relieve pain and can enhance local circulation and help the body to function well. That's a really clear way for them to understand what it does, right? Whereas explaining it from a more traditional Chinese medicine perspective can be hard for some of those practitioners to grasp. And you can certainly state that it is based on traditional Chinese medicine and follows meridian theory, and that you can explain that as well. But having a more lay perspective can make it easier for them to understand. And provide some information about your particular practice, you know, where you practice, what your approach to treatment is, talk about your training and specialties, and share that information. I'm just checking the chat once more to see. I'll just pause. I'm a physio and I would love to hear how you work collaboratively with physio on the team. I will talk about that momentarily. Anneline or Anneline? What a lovely name. And Dawn also said the collaboration helps to develop awareness about each other's disciplines. Exactly. And to see and understand health and healing in a more holistic way. My dog is insisting on joining us. I hope you don't mind. I'll just keep her here. She's getting very antsy. So, and Dawn also said this is a real gold standard of healthcare provision, lucky patients and practitioners. And yes, it is. I feel very fortunate to be working there, and I think our patients really are very fortunate to be able to access such comprehensive care. So when you provide information to other healthcare providers, another great thing to do is to offer a short meeting to discuss it further. Rosa, you're being very sweet. Now stop. So just put that out there, you know, provide them with a very short letter, keep it as short and concise as possible with the basic information about Shiatsu and your practice and your training and your specialties, and offer a short meeting to discuss it further. Just open that door so that if they're interested, they can pursue that. And it's a great idea to follow up with them later on to see if they have any questions for you and see if they want to discuss it further. Yes. So, and you know, you can follow up just to touch base and see if they received your information. And certainly the best way to do this is electronically, although some people have a preference for paper, but doing it electronically takes a little pressure off them rather than phoning them up with a follow-up. It's that way they can read the email at their own leisure and you're not interrupting their busy day, right? So other ways to facilitate collaboration include seeking opportunities for networking. And this is hugely important too. So certainly forums like this are great ways to network, different online forums, whether they are virtual gatherings like this, or whether they are chat rooms, or some of the Shiatsu Facebook groups, that sort of things, and other Facebook groups with other natural health practitioners or complementary practitioners. Workshops and conferences are wonderful for this, of course, and speaking engagements. So I know some of you do speaking engagements as well. And whether that is for the Shiatsu community itself or for the larger healthcare community, it's a great way to network and meet other practitioners and talk about what you do and how your interests overlap or meet up. So I've done a number of speaking engagements for other healthcare organizations. I've spoken for the Canadian Pain Society at one of their conferences. I was the first non-medical practitioner to present for them, which was rather daunting, but it was a great way to touch base with other people who had an interest in pain management, as I do. And I've done speaking engagements with the Alzheimer's Society as well, and a number of hospital organizations. Volunteering with health organizations is a great way to make connections and open the door for collaboration. So there's a number of ways to do this as well, again, depending on what your interest is. I have an interest in, as I said, neurological conditions, particularly migraine, but also Alzheimer's and dementia. It's a topic that's very close to my heart. And I've volunteered or done workshops at a very reduced price for organizations that work with people living with Alzheimer's and for care partners who are looking after loved ones with Alzheimer's or dementia. And it's a great way to meet other healthcare providers who have that same interest, right? You can also volunteer at different events like some of the marathons that are for particular, or runs that are for particular causes. That's a great way to meet people who have those similar interests. I used to volunteer with Ronald McDonald House Toronto, where I gave treatment to the children who were getting treatment at one of the local hospitals, and to their parents, and their families had come from out of town to seek medical care for very, very serious health issues, so often life-threatening ones. And I met through doing that at their different events that they had, you know, volunteer appreciation nights and that sort of thing. I met a number of other practitioners who worked with kids living with cancer and that sort of thing. And it's a wonderful way to touch base with practitioners. So there was a question about how I collaborate with our physiotherapists. So I'll just touch on that before we move on. We see a lot of the same patients. She refers a lot of patients to me, and often there are patients that I see who I think could benefit from a physiotherapist perspective. So patients that I see that have perhaps muscle imbalances, often they tend to be musicians. I find our dancers, because they learn how to care for their body, right? When you're learning dance, you learn how to stretch and how to warm up and how to maintain your body. You also learn a little bit about anatomy. And dancers tend to all have very good posture. That's just part of it, right? They learn how to use their body well. Musicians are not taught how to do that. So they're just like elite athletes in that they overuse certain muscles and underuse other ones, but they're not taught how to care for their body or how to warm up properly or how to prevent injury. So a lot of the musicians that I see need help in that area, and they'll come and they'll have muscle imbalances, they'll have poor posture when they're playing, they'll be compensating for muscle weakness perhaps in strange ways, so that they end up in pain and often unable to play. So a lot of those people I refer to our physiotherapist so that they can get some help with improving their posture when they play, and she can really address those muscle imbalances, so they're strengthening the muscles that need it to support the ones that are overworking, and help them develop core strength as well. So that is one of the ways we collaborate. We often, more than any other practitioner in the clinic, actually, I often touch base with her. So whether I'm telling her what I found with a particular patient or how they're coming along, you know, I'll say, look, this aspect of their health needs is really improving. You know, maybe their carpal tunnel syndrome, well, that's gone now, and they only have some minor muscle tension in that area that's pretty much resolved, but they're still struggling with this part. You know, we've made a bit of progress, but we're not quite there. And it will allow her to sort of tweak her approach with them so that she's really targeting that as well. And she'll come to me and say, well, look, this person has this issue going on, and you know, we're working, for example, with, we've got actually 2 patients now that we're both seeing who have spondylosis in the neck. So it's a form of osteoarthritis, which makes it contraindicated to use strong pressure on the neck. Not that I use deep pressure on the neck with anyone, but it has to be gentler with these particular patients. And we've touched base sometimes about how that's proceeding. And yeah, I'm not sure what more I can say about the way we collaborate. Does that answer your question?
Thank you. Yeah, it does. I think where I'm kind of coming from is, like, as a Shiatsu practitioner, are you working more from an energetic point of view? Or are you looking at, say, if somebody comes in with a frozen shoulder, are you kind of more working on the meridians around the shoulder? I'm wondering, like, how do the two marry, the physiotherapy and the Shiatsu? Because I sometimes find when I work as a Shiatsu practitioner, I nearly have to switch into Shiatsu mode, which is a more kind of an energetic type of a mode than the pure physical aspect of physiotherapy.
Well, so that's a very good question. And I practice Namikoshi Shiatsu, which tends to take a more Western approach. So some of the points end up being the same as other forms of Shiatsu, but it is a little bit more comprehensive, and the points tend to be based on not only on anatomy, but on physiology. So the Namikoshi Shiatsu points tend to be at places where there's been found to be a greater physiological effect on the body. So they tend to be based, the points often follow muscle lines, nerve pathways, and blood vessels. So it is a more Western approach, which I think makes it easier for me to talk about what I do with the practitioners that I'm working with. And I'm certainly not discounting the energetic side of what I do, because that is vastly important and a big part of Shiatsu. Even from a Namikoshi perspective, it is still a big part of Shiatsu, but I don't strictly work from a meridian perspective. So yeah, so how do I communicate? I do talk about blockages, and I do talk about increased energy flow when I'm talking to some of our other practitioners, and talk about and the sensations I feel when I'm working on an area. I not only talk about increased muscle tone and that sort of thing, but I also talk about what I'm feeling, what I'm palpating from a more TCM perspective. So when I'm applying pressure and I'm reading the sensations from the body and I'm working on an area, I might describe in my treatment notes that, this particular area, there was a really wiry sensation, right? Which certainly isn't a medical term or a medical way of describing that. That's really very much a Shiatsu thing, right? A wiry or buzzing sensation. I'll sometimes say that sort of thing, or tight and wiry. So I think in reading my treatment notes, because they're fairly comprehensive, and they'll see sometimes that I explain that, I describe it that way, I think they understand that when I'm describing it like that, that from an energetic perspective, there's something going on that I'm trying to address. And again, because there's that respect for each other's discipline and some understanding of what we do and how we work, I think they get that, even though they wouldn't use those terms themselves.
Yeah, thanks.
Yeah, not at all. And certainly our craniosacral therapist would understand that concept, and our chiropractor who does craniosacral and acupuncture, they would understand those terms when I say it. That feels really wiry or something like that. They would get that. Or, feels really, the energy feels restricted or blocked. They would understand that, of course. They use those same terms. So that is sort of the end of my formal talk on this. So if there are questions, I'd love to have some dialogue. First of all, do you think, for those of you who are working either in private practice or maybe in a multidisciplinary clinic, do you think some of the strategies that I talked about might help to facilitate, to open up collaboration? Do you think they might help you to build some relationships and collaboration with other practitioners? Anyone?
Yes, wonderful. Definitely. Your talk was so inspiring. We need more collaboration and we need more exchange of ideas. Wonderful. I think there was just some questions in the chat.
I think we answered them so far. Yeah, I really think that increasing collaboration, I think it's one of the ways of moving Shiatsu forward, right? It's a great way to get more practitioners, non-Shiatsu or non-TCM practitioners, to understand what it is and just how effective it can be and what it can do, right? Shiatsu is wonderful for so many different conditions and so many different concerns that I think this is one way of really helping to get that understanding out there, right? I think if we want Shiatsu to be a greater part of the healthcare system, as it should be, then this is one way that we can address that, by increasing collaboration and building relationships with other healthcare providers. And another one of the ways we can do that is by doing more research. There's a very limited evidence base for Shiatsu, and I really want to see that grow. It is slowly growing, but I would really love to see more and more research to support what we do, because in the medical community, that is what they look for, right? They look for research to support what we're doing. It's great that we see the results in our clinic. That's wonderful, but we really need to be able to communicate that, and we need to be able to do research to support it, so that other practitioners can look at that and say, okay, yeah, this is quite effective for X, Y, or Z. So I've done several research studies that I was fortunate enough to collaborate with a number of other practitioners on. So it was a multidisciplinary team. Our principal investigator was an occupational therapist, and I was the Shiatsu therapist on the team. And we looked at the effect of hand self Shiatsu for sleep problems in people with chronic pain, in adults with chronic pain, in adolescents and young people with chronic pain, and also in veterans post-deployment. So with all of our studies, we saw benefits. They found that they were falling asleep faster and staying asleep more through the night, not waking as often, and waking feeling rested. So yeah, it was wonderful working with, again, just collaborating with an integrative team on that. And yes, what else was I going to say about that? Yeah, so I think we really need to see more research. And I think part of the issue with that is, of course, funding. It's difficult to get funding to do a research study, but part of it is an understanding of how to do research, right? In the massage therapy schools, at least here in Canada, they are taught basic research skills. So they're taught how to do a case study. And a case study is the simplest form of research. It's the easiest for a practitioner to do. So it's based on just one patient that you've worked with, that you've seen some sort of result from your treatment. And it's the easiest form of research to do. And if we had that kind of basic research skills integrated into all of our Shiatsu programs, then all Shiatsu practitioners would have just an understanding of basic stuff, how to read a research study and how to allow research to inform your practice, and maybe how to do a basic case study with one patient. And the more of those we get published, the more research evidence base there is for Shiatsu. So Dara has a question. If you'd like to unmute, please, or maybe it's a comment. Go ahead though, Dara.
Yeah, I'm trying to figure out how to do this Zoom thing. I hope everybody can hear me. Can they hear me?
Yes, we can.
So I started doing Shiatsu in 1976. And as Kumiko knows, I'm still like the youngest student of Ohashi, right, Kumiko? I don't think he graduated anyone younger than me. So after that, the regulations or the laws changed or something like that in New York City. You couldn't be younger than 18 and even take Shiatsu classes or something. So I was only 16 years old. But the challenge that I've had in the years is that as a young person, and even now, I'm 61 now, and your practice is medically based. So, and I don't know how it is in Canada. I've never been to Canada, but I can't imagine it's very much different from most other places. But in the United States, we have a proliferation of massage parlors. Everywhere you go now, there's a strip mall, at least in Florida and most of the places I know, everywhere is a strip mall of massage. And it's all regulated by the Department of Business and Professional Regulation in Florida, and in every other state, they have their own rules and regulations. So when I started, the reason I wanted to do Shiatsu was because I had known, I was macrobiotic when I was 14, and I was very disenchanted with the way that people just viewed it as massage, and it's still a sort of a sub. There's a sub. What would you call it? An element that people think, and they relate anyone touching them to that whole massage parlor industry. And there are only two tracks, basically. It seems like you have to go your medical route, and then you have to have insurance, and then you have to deal with case studies, and you have to go the medical route, but you're not a medical doctor, and you're never recognized as a medical doctor, but you're supposed to be, constantly training and so on and so forth. And then you've got to then insurance comes in, and people have that obstacle of actually paying for medical treatment, because now it gets considered medical treatment, but it's not covered by insurance. Then you go into a collaboration like you have, and maybe there are donors, maybe there's some help for people like this. Maybe you can convince the VA that you're in a setting where you're in a hospital and you're working with people. So that was always a struggle, and it still remains a struggle. People want, in the medical world, you go to your doctor's office, they rarely touch you. So, there's this whole thing that older people go to doctor's offices because they crave just some person just touching them, just putting a hand on their back to listen to their heart with a stethoscope or something, because people don't get touched in Western society. And then touch is associated with a sexual connotation all the time. And it's still that way. Acupuncturists are separated because they're using needles. They're not really touching you. And as soon as there's a touch component, there's some psychological and social stigma still associated with someone touching the human body. And we haven't broken that down. Since I was 16, we're talking 45 years, 46 years now. And it has still never been broken down. There are classes you have to take in human trafficking now. Human trafficking, like we're massage therapists. We have to be massage therapists in order to do Shiatsu. You cannot touch someone in the state of Florida legally unless you have a massage therapy license. You can't, and that's most states. You have to. Shiatsu got subsumed under the title of massage because it's contact with your touch. So I'm a lawyer now, and unwanted touch is considered battery. So you can actually be, sued for battery for touching someone in the wrong way. So we have to find all these rules and regulations of how to touch people, and then it's got to fit the Western modalities and the mindsets and the licenses and the regulations, and then we're forced to pay lots of money to keep getting our licenses, and then we have to constantly meet the requirements of all of these medical rules and regulations that don't allow us to actually really elevate what we're doing to anything more than still subsumed under the label of massage therapy. And then massage therapy is not paid for by insurance. It's still not something covered. And we've maybe made progress but we really haven't. And to collaborate like what you're doing, you're very fortunate to be able to have been able to get into this group setting and to work through hospitals. I trained a woman when I was only 17 or 18 years old. I was teaching her how to do Shiatsu 19. I think, no, I was 18 or 19 after I had finished with this school. And I was living in Florida. She was a nurse working in a hospital in Miami. And so she already had a foot in the door as being a nurse. She was a registered nurse in an operating room. So they took what she was doing as valuable, or they accepted what she was doing and introducing Shiatsu in a very limited way to people, because it still involved touching people.
Mhm.
And she got some recognition. I lost touch with her many decades ago, but I could never do that. I wasn't a registered nurse. I wasn't in the field of medicine, so I could never be taken seriously. And I was young, so I didn't know what I was doing. So it's very challenging when you're someone who is, I don't know what it's like in the other countries for all the other women who are on Zoom, but most of the time in my life, I've had private people who come to see me. There's still that expectation. I can't tell you how many hundreds or thousands of times there's still that expectation that it's massage parlor stuff.
Mhm.
And the people don't, the stigma is still there. We have never really broken the stigma down. People don't really even know what Shiatsu is. They
We have some work to
know
do.
what
in that area.
acupuncture is,
Yeah,
So
we have some work to
it's-
do in that area to make more people understand what Shiatsu is and what it can do. But I think the situation here might be a little bit different. I mean, of course, I'm licensed and I do have insurance. I can't practice without a license, and I can't have a license without insurance, and I can't practice without insurance. That's the case whether I was in the hospital or not. If I were working out of my home, I would still have to have a license and insurance to practice, and I wouldn't
Correct.
consider
Right.
practicing
We're
without.
all
But
sued.
Shiatsu is in Canada, Shiatsu is a very separate thing from massage therapy. It's not, massage therapy is regulated in a number of Canadian provinces, which I don't completely agree with, because regulation is about risk of harm. So regulation happens if there is a potential risk of harm with a certain practice, right? So there's very little risk of harm with massage therapy. The only thing that heightens the risk of harm with it is that people are disrobing and being draped with sheets, right? So there's a bit of a power differential because someone is disrobing, right? And we don't have that with Shiatsu. I have a couple of patients who prefer to disrobe and be draped under a sheet, but generally people, when they receive Shiatsu, are clothed, so we don't have that risk of harm. So yeah, massage and Shiatsu are very separate things here. And you're right. I am extremely fortunate to be working in this atmosphere at the clinic I'm at, and to be working for a hospital setting. But certainly in other countries, there are some instances of Shiatsu being used in hospitals. So there's, not a lot, but I know there's a chronic pain clinic in Berlin that offers Shiatsu. I know there are some Shiatsu therapists working for a hospital in Switzerland. And I know in England, in the NHS, there have been Shiatsu therapists working with cancer, people living with cancer, and a few other places in Uruguay. Diego Sanchez has been working with people.
Yes, but what I'm saying is that we in the United States, it's still, you're, like I said, you're very fortunate to have been able to get into this little group, but that's only few and far between. In order to make the picture larger, in Canada, you have a separate license for Shiatsu and a separate license for massage therapy. Is that what you were saying?
Massage therapists are regulated, yes. So they have to belong to the regulatory college to practice massage therapy.
Right, but what about Shiatsu people?
Provinces. Shiatsu therapists in most jurisdictions have to have a license to practice. So it is not a Shiatsu license, but it is referred to as a holistic practitioner license. So if you practice Shiatsu or you practice reflexology or Thai massage, for example, you would have to have a municipal holistic practitioner's license to practice. And to obtain one,
So
you have
that's what they used to do. That's what they used to do here. But then they stopped the differentiation, and now it's all just lumped under massage therapy. So I'm not sure how it is in New York, but in Florida, you can't touch anyone legally as any kind of holistic or non-holistic Western medicine person, unless, I mean, you can, but you risk getting caught and sued and sanctioned. But it's all kind of one thing. It's the practice of touching someone with your hands and doing anything to them manipulatively. So, except for, chiropractors have their difference and doctors have their difference, but non-medical kind of, it's still considered non-medical. And that's what I'm just making a comment, that I think that your practice is would be great if everybody could do that. But in the United States, we have these very strange, stigmatized wild west things still going on, and people still think of any form of touching as a massage parlor kind of image. Even if people are wearing clothes, it's still the average person doesn't even know what Shiatsu is and has never experienced it or had anybody who's ever experienced it. Whereas you talk about acupuncture, there are always advertisements and billboards and conversations, and people know what acupuncture is. And that seems to be more socially acceptable because there's a needle between the person and the practitioner. So you've got a distance. And that's it's unfortunate what I've seen in all these years, that the whole method of embracing someone or touching someone is seen as something intimate, as opposed to something that is socially acceptable and not overstepping someone's personal boundary. So in your setting, it's wonderful.
Yes.
I think it would be.
Yes, we have so
great.
much around from different countries, and Shiatsu is transforming energy to the different countries, and this global Shiatsu virtual gathering give us the input. And there's so many great teachers, and there's so many great practitioners. They are so dedicated, so consistently teaching and sharing Shiatsu, healing hands with others. And we've been learning so much from Leisa in Canada, Lviv in Israel, and Diego, Uruguay, and so many different countries. And we are so grateful. And United States, we have so much to do. We all need help. And all the outside information comes to the United States. And we hope to make a difference in the United States. And next Saturday, we have Cliff Andrews. He is another great inspiring teacher. He's been teaching Shiatsu over 40 years. He was student of Pauline Sasaki, and I am so grateful to have him. And he's gonna talk about how Shiatsu is important. Shiatsu is the best therapy for the world in the 21st centuries. I believe it, and I hope everybody believes it. I hope we can just keep going with the wonderful offering we can share with the people in the all over the world. People need shiatsu more than ever. So Lisa, thank you so much for your inspirational talk. We have so much to do.
We will get there. And I think gatherings like this will really help us to build the Shiatsu community and, give us, help to build opportunities and ways to increase Shiatsu's profile around the world. It will happen with more research and more community like this. It will happen.
Yes, and because we know because we can connect through internet, we can learn about what is happening in other countries. So that means more inspiration, and we can connect with each other. That means more empowerment. So there's a lot to do, but because we can come together, we can make a difference.
Definitely.
With joint forces, we are strong.
Do we
Also, we have online courses. Online is universal. Anybody can join to learn.
Do we have just 1 minute to, I know Panayota has her hand up. Do you have a quick comment or question? Do we have time? Hello.
Hello. So nice to see you all. Lisa, while I was listening to you describing your work, it seems like the paradise on earth. I mean, it's so idealistic what you are describing. Greece is far away from what you described. Congratulations. And it's very encouraging to know that there are practitioners, colleagues who do this kind of work and this collaboration. My dear uncle is suffering from cancer, and he is hospitalized in a very good hospital, private in Athens. And I want to tell you this, the team of his oncologist didn't consult him to go to the nutrition practitioner of another oncologist team, because this nutrition practitioner is not part of his oncologist team, and he could have done so many things about his nutrition while he was under chemotherapy, and he had no idea. And he only learned about this lady 6 months later, when he had a huge side effects from chemotherapy. This is how Greeks still work. So this is very sad. I wish you all a good weekend, and I'm very happy to be here with you. I'm very grateful, Kumiko and Eva, for your commitment.
Yes, thank you so much, Kumiko, and thank you to all of our participants. It was wonderful to chat with you. And if you have any other questions, please shoot me an email or connect with me on Facebook, or Leisa Bellmore, call my Shiatsu therapist on Facebook, on Instagram at Shiatsu Heals. And yeah, I'd love to hear more questions or more thoughts if you have more to say. It's fascinating.
Panayota says, congratulations, Lisa, for your hard and inspiring work. And Don says, thank you, Lisa, for this very valuable sharing. And Laurie says, thanks, Lisa, for an inspiring discussion. And Dara says, keep up the good work in Canada, Lisa. The understanding that it is not a massage is the challenge.
Mm-hmm.
And Annelen says, thank you very much, Lisa. And we would like to thank you as well. That is a pleasure to have you, because what you just said, it sounds like you work in oasis for artists and the whole world can learn from you. And we should have this kind of places in every country.
Definitely.
So hopefully we will get there. Thank you so much.
Thank you, Eva.
So thank you everybody for joining today, and let's meet again and empower Shiatsu community. So put the person together and gasho. Thank you, Lisa. Thank you, everybody. Have a great
Thank you.
week. Thank you. See you soon. Bye.
Have a lovely weekend.
And we also upload all the recordings on YouTube channel, so you will be able to watch this one as well as previous gatherings on YouTube. Please subscribe. Thank you for subscribing. The more subscribers, the more likes, the more comments, the more exposures of the videos to broader audience, because of the algorithms and internet. That's how they work. If they see that you click like or you comment or you subscribe, that means for our algorithms that you that the content is interesting, so it shows to more people. So this is how we can support each other as well, because we have over 200 recordings. No, I think 150. So it is 150 lecturers on the YouTube channel. So this is also how we can support each other. So thank you again. And see you
Thank you,
next
everybody.
Saturday.
Let's make Shiatsu community stronger. Bye.
Bye-bye. Take care, everyone.